All right, well, welcome everybody to Verda's webinar on how what you eat affects your sleep. I'm Dr. Brittany Volk. I'm joined by Dr. Krista Van Dort. We'll both do a little bit more formal introductions shortly. But Verda is the leading treatment to reverse type 2 diabetes safely and sustainably without medications or surgeries. Now, today we'll be talking more about Verda, what we are, what we do. We will discuss the sleep epidemic that exists today, how you can improve your sleep, and how we at Verda help patients do that, and that's where Dr. Van Dort comes in. We will then get more in depth about our treatment and how we reverse diabetes, improve sleep, and do so much more. And then I'll end on discussing really the patient experience and what it really looks like to do all of those things. Now, before we really get going, I want to go over some logistics here today. So you, throughout the presentation, are invited to submit questions via the chat box. In that chat box, you have the right to submit a question anonymously if you want your name to remain anonymous. So please be sure to click that box if you'd like to do so. You can enter a question at any point, and Dr. Van Dort and I, along with her assistant Morgan, will join us at the very end, and we'll be answering your questions. Now, I'll give you Morgan's introduction. So Morgan is actually the lead author on the research paper that Dr. Van Dort is going to review, and he really was intimately involved in not only writing the paper, but analyzing the data, and so he knows all of this inside and out, and so we wanted to bring him here today to be able to really answer all of the questions that you might have. So we're lucky to be joined by Morgan as well at the end. Now, here's a great quote I wanted to start us off with. Sleep has a substantial impact on the overall health of people with type 2 diabetes. With that in mind, it is promising that the Verda treatment improved patients' subjective sleep as indicated by significantly lower global PSQI scores, in addition to improving their diabetes. Now, if you're not sure what any of that means, that's okay. That is from Dr. Van Dort, who is I'm going to introduce her now, and she's going to talk about sleep in a few minutes here and tell us all about what this quote means and how this impacts you. So Dr. Van Dort, please introduce yourself.
Hi, thank you for including me today. So I am an assistant professor at Harvard Medical School, and I've been studying sleep for the last 16 years or so now. I have a family history of diabetes and heart disease, so I've had a long time interest in figuring out how I can also maintain my own health. So for me personally, having the low carbohydrate diet has worked really well for keeping off that diabetes and maintaining my own health. And now I'm excited to be able to study that in conjunction with my sleep research as well.
Thank you, Dr. Van Dort. As I mentioned, I'm Dr. Brittany Volk, and thank you, Dr. Van Dort, for sharing that personal story. I have a similar, and so I'm just finding out this now, so it's really nice to know that we share this common passion of utilizing a low carbohydrate approach to keep diabetes at bay, because it runs on both sides of my family as well. So I think it's kind of right there. So I'm Dr. Brittany Volk. I am a registered dietitian and a nutrition researcher, and I'm on the clinical education team here at Verda. As the first health coach really working with patients here at Verda, I've just become so passionate. I was researching low carbohydrate nutrition with Dr. Jeff Volek at the University of Connecticut, and I saw the impact that simply changing the way that one eats can really influence your health and your quality of life. And as I mentioned, having family members who have had type 2 diabetes, I've seen the impact that it not only directly has, but also from the complications of type 2 diabetes. And I thought, I want to be able to translate all this research that I'm doing into how this can actually help people so they don't have to go through this themselves or watch family members go through this. So that's why I do what I do here at Verda. And am excited to be here with all of you today. Now, I mentioned you can put questions into the chat box, and thank you for letting us know that the volume seems a little low, so Dr. Van Dort and I will speak up. So if that happens again, please feel free to submit that. If you cannot see my slides, let me know, and we'll get started. So I said I would start a bit about giving you the background of Virta. Now, our mission here is to reverse type 2 diabetes in 100 million people by the year 2025, which might sound ambitious because I thought the same thing, but we're well on our way to doing that. We have an ongoing clinical trial going on. Our principal investigator is Dr. Sarah Hallberg, and we're finding some really incredible results. Now, one of the primary results, as I said, we're in diabetes reversal. That's our mission here at Virta. And we're seeing that at 1 year, 60% of those completing patients reverse their type 2 diabetes. And when I say reverse it, here's what it means. Diabetes is fundamentally a problem of blood sugar control. Now, when patients can get their blood sugar under control, without the use of diabetes-specific medications, they have successfully reversed their type 2 diabetes. And that's what it means when we say 60% of completing patients reverse their type 2 diabetes at 1 year. In a room of 100 people, 60 of those individuals have gotten their blood sugar down below the diabetic threshold, and they've removed all diabetes-specific medications. We see the blood sugar control through what is called a hemoglobin A1C, and that is simply a 3-month measure of one's blood sugar control. So at 1 year, we saw an average of a 1.3 drop in a person's A1C, getting them below that diabetic threshold. And we saw medication reductions, as I mentioned, including insulin. So these are some significant results that we're seeing at 1 year. And we are running the largest and longest clinical trial. We're actually now moving into our 4th year of the trial. It was originally a 2-year study, and we've decided to extend it so we could really look at that long-term effect as well as the sustainability of the treatment. And most notably, or a notable point to make, is that the ADA, the American Diabetes Association, has now recognized our treatment as an option, as a first-line therapy in treating type 2 diabetes. And so it's really important to note that they recognize that a low-carbohydrate eating plan, as Virta has implemented, may result in that diabetes reversal, because we're showing that it does. And beyond diabetes reversal, here are some of the benefits our patients are seeing. Lower blood pressure, improvements in heart disease risk factors, reduction in inflammation, improved liver function. And today we're going to be talking about the improvements that our patients see with sleep. Now, before we go any further, I just want to give you a high level of what Virta is. So there's 2 main things that really make the Virta treatment the Virta treatment. It's our clinically proven medical nutrition therapy that's largely based in carbohydrate restriction, that is science-backed. So we make science-based nutrition recommendations based on decades of research. And it's the way that we deliver that treatment. So we call that our continuous remote care, because essentially we have an entire team of Virta physicians and health coaches who are helping to implement this into your lifestyle, providing real-time, individualized care. So I like to put this image in your head. If we were to hand you in your pocket through an app a health coach and a physician who is there to answer questions at any time, make medication changes, offer support, provide you education and guidance, that's essentially what we're doing here at Virta. So I wanted to set that context before we go any further in talking about our results and the nutrition and all of that. And know that if you are eligible, it is fully covered. Out of pocket, this is about a $5,000 per year expense. And if you qualify, your employer will cover the cost for you. Now, we can't answer questions about eligibility at this time because it is employer specific, but you will receive an email after this webinar with a direct link to go to for your employer, along with eligibility information and how to apply for the treatment. And if at any time you would like to ask us a question directly, you can email support@virtahealth.com and be sure to include your employer name. But again, look for that email after this webinar. And with that, I want to move on to the main topic of today, which is really talking all about sleep. So I am going to turn this over to Dr. Van Dort. It's just going to take us a second here to get caught up. Remember that you can ask questions at any time, so please do so.
Excellent. Thank you very much. So today I'm going to talk to you all about the importance of sleep. Many of you probably intuitively understand that sleep is important, but I just want to review some of the things that sleep might be doing that's important for your health. So and remarkably, there's not one clear consensus on the function of sleep. However, there's a number of different things that contribute to the improvement of health with sleep. One of those is cleaning out the brain. So throughout the day, you end up having all this waste accumulate in your brain, and the lymphatic system can help clean that out while you're sleeping. In addition, you have clarity of thought. Anyone who has had a sleepless night can understand that it's harder to function the next day. In addition, you have improved learning and memory. So what you've learned throughout the day is consolidated at night. You also have emotional stability. So anyone with little kids, if they don't get sleep, they end up being much more emotionally fragile. In addition, it improves your immune system, as well as helping you conserve energy and be protected at times when the environment might be unsafe to be there. So sleep is made up of two different phases. There's REM sleep and non-REM sleep. And in this image, it's indicated by N1, N2, and N3. Those are three different depths of the non-REM sleep. REM stands for rapid eye movement. It's the stage of sleep where you dream the most and your eyes move back and forth in your head. So there's a specific pattern of sleep that's really important for health, and that is having this deep N3 sleep, non-REM sleep, at the beginning of the night. And as the night goes on, you end up having more REM sleep towards the end of the night. And those are really important for being able to have restorative sleep so that you feel like you've gotten rest the previous night. So how much sleep do people need? On average, it's about 8 hours of sleep per night, yet over 41% of adults in the US get less than 6 hours of sleep per night. And so not only those functions of sleep that I mentioned earlier, but if you have not enough sleep, it's associated with other chronic conditions as well, including type 2 diabetes, heart disease, obesity, and depression. So there's a lot of consequences, not just the ones listed earlier, of having insufficient sleep. So type 2 diabetics are particularly prone to having poor sleep. So over 50% of type 2 diabetics have some sort of sleep disturbance. And in addition, 33% have some sleep disordered breathing. So one example of sleep disordered breathing is obstructive sleep apnea. And so obstructive sleep apnea is where your airway collapses while you're asleep because you lose muscle tone, and then you have to wake up in order to regain muscle tone and be able to breathe again. So that really disrupts your sleep. You can wake up 60 times an hour if it's really bad. And if you're obese and you have type 2 diabetes, greater than 86% of people can have obstructive sleep apnea. So if you lose weight, it improves the airflow and can decrease the number of arousals that you have so that your sleep is more consolidated. So what other things can you do to improve your sleep? So one of the main things is reducing screen time, especially right before bed. The blue light is uniquely stimulating. It tells your brain that it's daytime and you need to stay awake. So either not using a screen at all, or there's different apps out there that can reduce the blue light and make your screen red, and the red light doesn't arouse you as much. In addition, you can avoid caffeine and alcohol, especially later in the day. Caffeine has a long half-life, so if you have it after around 2 p.m., then it's potentially going to affect your sleep at night. You can go to bed and wake up at the same time each day, so that's called good sleep hygiene. That helps keep your circadian rhythms on the same schedule and helps you fall asleep and have good quality sleep. You can exercise regularly and improve nutrition, as I'll go into next. So this relationship between nutrition and sleep and glucose sensitivity is multifaceted, but the better sleep you have, the more glucose tolerance you have and better increased insulin sensitivity. And we don't know exactly if you just increase insulin sensitivity and glucose tolerance, whether that's going to directly increase sleep. But there's definitely a relationship between these three factors. And so next I'm going to tell you about a study we did with the actual Virta treatment on type 2 diabetic patients to see how they improved in sleep. So there were 3 groups of people: type 2 diabetics with the Virta continuous care intervention. There was the pre-diabetics with continuous care intervention, and then type 2 diabetics who were receiving the usual care. So they took a sleep survey at the beginning of their treatment and after 1 year of being on the Virta treatment. And that sleep study is called the Pittsburgh Sleep Quality Index. And so what that does is it tries to assess 7 different aspects of sleep. First, it looks at sleep quality, then sleep latency, which is how long does it take to fall asleep, sleep duration, and sleep efficiency, which is how much of the time you spend in bed are you actually asleep, in addition to sleep disturbances, use of medications, and daytime dysfunction. And so the Virta treatment improved 3 aspects of sleep. It improved sleep quality, sleep disturbances, and daytime dysfunction. And this graph shows that people who had poor sleep were significantly reduced at 1 year in the 2 groups that had the continuous care intervention Virta treatment. So if you had type 2 diabetes, you had a reduction in poor sleep. So that means your sleep improved. Whereas on the far right, you can see that if you maintain just the usual care type 2 diabetic routine, there was no improvement in sleep at all. So if you look at this in another way, you can see that in people with type 2 diabetes who were receiving the Virta treatment, there was a 14% improvement in overall sleep. And this came from 19% improvement in their subjective sleep, an 11% reduction in their sleep disturbance, and a 38% improvement in their daytime dysfunction. And this was also true for the group that was pre-diabetic and on the Virta treatment. So they had a 20% improvement in overall sleep, a 25% improvement in subjective sleep quality, 20% reduction of sleep disturbance, and a 36% improvement in daytime dysfunction. So what you can see from this study is that both pre-diabetics and diabetics had multiple ways that they improved their sleep with the Virta treatment. And I'm happy to take questions at the end, and Dr. Volk will go through in detail what the Virta treatment involves.
Excellent. All right. And I will also, thank you, Dr. Van Dort. I will also get a little bit more into what Dr. Van Dort mentioned about the glucose, which is blood sugar, and insulin relationship, and then how what we eat impacts that and how that can then improve our sleep. All right, now again, the Virta treatment is based on those 2 things I mentioned, right? So that individualized nutrition that's based on carbohydrate restriction, which is based on decades of research, and there's a lot more that goes into that in terms of the Virta treatment, but then it's also how we deliver that, so providing that care team in your pocket basically around the clock. We're monitoring medication changes and all of the entries and information that you enter into the app, we're seeing that in real time. And I will share with you in a little bit so that you know what exactly this looks like. I will share with you an experience of a patient so that you can understand from start to reversal what the Virta treatment really looks like. But before we do, I said we're talking about nutrition and how what you eat can improve your sleep, right? So let's talk about what we eat. But when we talk about what we eat as a dietitian, I like to start with the very basics. And this comes down to macronutrients. The foods that we eat fall into 3 main categories: carbohydrates, fats, and proteins. And these are largely based on what the food is and what it contains the most of. So let me give you an example. When we say carbohydrates, we're talking about things like breads, rice, potatoes, fruits, and vegetables. They contain mostly carbohydrates. Now, fats are things like butter, and olive oil and coconut oil. Now, they also occur in protein sources, but when I'm talking about protein sources, I'm referring to eggs, nuts, fish, seeds, and what did I say? Let's see, tofu. Sorry, stumbled there. But so our three main food macronutrients are carbs, fats, and proteins. And this is an important foundational principle because we're going to be talking about the impact that these different macronutrients have on us when we consume them. And if we want to know how food can improve our health, we have to know what foods do what. Now, this I'm guessing looks familiar to you, the dietary guidelines. Now, I know that we no longer truly follow a food pyramid, but the principles are the same and we recognize the food pyramid. So I like to show this when I talk about what we're currently recommended to consume. Now, remember that diabetes is a problem of blood sugar control. And prediabetes, it's basically one step before diabetes with the underlying issue being a problem of blood sugar control or insulin resistance. Okay, now we are told that we should consume most of our calories as carbohydrates, those bread, cereal, rice, pasta, right? Then some fruits and vegetables still falling under that carbohydrate category, dairy, and then meats and poultries. As we move towards the top of the pyramid, we're to consume less of them. So if you notice, fats are on the top and carbohydrates are on the bottom. So we're told to consume most of our calories as carbohydrates. Now, here's the issue. When we consume carbohydrates, they are broken down into sugar and they increase our blood sugar. Diabetes is a problem of blood sugar control, and yet we're told to consume most of our calories coming from this group that is going to raise our blood sugar. So we eat a slice of bread, it gets broken down into sugar, and it raises our blood sugar. When we consume, let's say, an egg, which is a source of protein, it will have a little impact on our blood sugar, but we need protein, and that's okay. It does not raise our blood sugar to the extent that carbohydrates do. Now, if we were to consume fat, fat has no impact on our blood sugar. But remember, fat is at that top of the pyramid based on standard dietary recommendations. And if diabetes and prediabetes means we have a problem with blood sugar control, why are we told to consume very little fat and mostly carbohydrates? It really doesn't make sense. And I want to dive a little bit further into what that looks like in terms of how foods really do impact our blood sugar. And in order to do that, let me take you through an example. So when we talk about blood sugar, what does normal even mean? When I talk about elevated blood sugar, what does that even mean? So normal blood sugar, let's say, is about 100 milligrams per deciliter or less. And what that really looks like is that an average adult has about 5 liters of blood in the body. So that's about 2.5, 2-liter bottles of diet soda. So 100 milligrams per deciliter in that amount of fluid is only 5 grams of sugar, or a teaspoon of sugar in your entire body. That's considered normal. That really is not very much. And in looking at what this looks like in a food source, so let's look at a cup of brown rice. Now, a cup of brown rice is something that many of us probably think is a healthy choice, right? It's pretty low in calories, it's low in fat, it's high in fiber, and it's high carb. We're told to consume a lot of carbohydrates. Now, a cup of brown rice contains 45 grams of carbohydrates, which equals 9 teaspoons of sugar. Now, I just said we're only supposed to have about 1 teaspoon of sugar circulating in the body to be considered that normal blood sugar, but we just consumed 9 teaspoons of sugar. So that brown rice is raising our blood sugar. Well, our body really wants to tightly control our blood sugar and get that 9 teaspoons back down to a teaspoon. And what that comes down to is insulin. So insulin is a hormone, as Dr. Van Dort referred to, and insulin's job is to do just that. When we eat carbohydrates and our blood sugar goes up, insulin is released to then push that blood sugar out of our circulation and into cells where it can then be used for energy. That's fantastic. And in someone that, we need insulin, and in someone that has a high tolerance to carbohydrates, that system works just fine. They eat the cup of brown rice, their blood sugar goes up, but it comes down because insulin does its job very nicely. In someone who has a lower tolerance to carbohydrates, and there is a spectrum, it's not black and white and it's simply high and low tolerance, there is a spectrum. But if someone with a low carbohydrate tolerance consumes that very same cup of brown rice, they're following the exact dietary guidelines, they eat that same cup of brown rice, their body, their blood sugar raises, insulin is released, but their body's cells don't recognize it the same way. So the response is that their body puts out more insulin to try to get that blood sugar back down to that normal level of 1 teaspoon circulating in their body. Now, the problem here is, as I said, we need insulin. We need it to maintain that normal blood sugar, but it is our fat storage hormone. It prevents our body from utilizing the fat that we store on our bodies, and it actually signals our bodies to make more fat. And so, when you eat a meal with carbohydrates and your blood sugar goes up and you are someone who has a low tolerance to carbohydrates, or your body is insulin resistant, our body has a hard time regulating those blood sugars. And we're eating all day long, right? So you have breakfast and maybe some carbohydrates in your breakfast, say oatmeal for breakfast, right? Your blood sugar goes up, insulin levels go up, our body is signaled to store fat and not utilize the fat that we have as an energy source. And then, okay, your blood sugar will come back down, but then what happens? It's time to eat again, and the same cycle happens all day long. And so with Virta, we take what I call a very common sense approach, that if you are struggling to maintain normal blood sugars and you're following the traditional dietary guidance, if you kind of flip that pyramid and you think about consuming more fats, which don't impact your blood sugar, and you reduce your amount of carbohydrates to what allows you to maintain normal blood sugars, you can quickly gain control of your health. You can reverse diabetes, improve sleep, and get to all of those other benefits that we shared with you. So our goal is to find a dietary approach that helps you reduce your carbohydrates below your personal tolerance. And our approach achieves blood sugar control or glycemic control without the use of medications. So we're not adding blood sugar medications and diabetes medications. We are taking them away. We're not just taking them away all at once. We're doing it based on how your body is responding to the treatment. So in a stepwise decrease, we call it deprescription of medications. And the reason our physicians do what they do and our health coaches do what they do is there is no one-size-fits-all approach to this. Every person out there has a different amount of carbohydrates that they can tolerate that will help them achieve that glycemic control without medications. And I will remind you, before I go into the patient experience and walk you through what it's like from enrollment to reversal, I just want to remind you again, you are welcome to submit questions at any point. And that's actually why I sometimes look over to the side, as I want to keep an eye on the questions that are here on my second screen. So please feel free to do so. Okay, so the patient experience here at Virta and how you can achieve results like this, like getting better sleep while reversing your diabetes. Let me introduce you to Wilma here. Wilma is a real patient of ours. I think it's really nice to share this experience in the eyes of Wilma and walk you through her journey. She is an average patient here. So Wilma came to us being well within the diabetes range of an 8.5 A1C, and to be diagnosed with diabetes you have to have at least 6.5. Her weight, nearly 200 pounds, and she was on multiple medications, including insulin. And if you or anyone you know takes insulin, you know what a painful medication that can be, because you're having to inject yourself multiple times a day. So you're not only, injecting yourself, but it can be inconvenient because you're carrying around syringes and needles and bottles of medication. And so to be on insulin along with other medications, as many of our patients are, you're eager to get off of those, and we're eager to help you. So we send out emails, we send out flyers, you probably got an email from your employer getting you here today, and that's because we are committed to getting this message out that you can reverse your diabetes. And so I just put this email up here again because if you have any questions, you're free to email us there. But when you first go to our website that will provide you the link in that follow-up email, you'll fill out some very basic information. You will then be assigned an enrollment advisor, and that person is going to be your single point of contact, an actual person that you can reach out to with questions. You'll schedule a call with this person. They can answer any questions, whether it be about the treatment or any sort of materials you need to gather in order to apply for the treatment. They're there to help you. Now, we are a fully licensed medical provider. So we are going to be collecting your medical history, labs from you. We'll get an EKG. We'll talk about any allergies, past surgeries, your entire history, as well as we want to discuss your health goals with you. And once we've collected all that information, and again, your enrollment advisor will help you do so, you will meet with your Virta provider. This is done through telemedicine. So just as we are here today through the computer or through your telephone, you'll be connecting with your provider through a telemedicine visit, so in the comforts of your own home. And this is Wilma having her telemedicine visit with her provider, Dr. Stanley, and that's what this actually will look like for you. Once you're approved for the treatment, you will receive a starter kit, and in that kit contains all of the supplies that you need to monitor your progress and your treatment. And so you'll receive a scale that is cellularly connected to your app. You will receive all of your testing materials, a glucometer, which will test your glucose and the testing strips, a ketometer, which is actually one device. So you'll be able to test glucose and ketones, and you'll enter this information into the app. That's what helps us, your care team, reach out with nutrition recommendations, maybe some simple tweaks you can make. It will allow us to make the proper and timely medication changes. So again, all of this will be supplied for the entire year that you are under our care. Now, after receiving your starter kit, you will get onto the app and you will meet for the first time your health coach. This relationship is so important because this relationship, your coach is on the front lines with you at all times. Wilma here, her health coach is Catherine. Catherine is able to answer questions that Wilma has at any time, and Catherine is also looking to see how Wilma is progressing through the treatment and able to reach out with those nutrition recommendations. So again, the coach is on the front lines, and we really, really take this relationship seriously and take a lot of time early on to develop this, including a phone call with your health coach so we can discuss face-to-face your goals of the treatment. Now, before even getting started with any dietary or behavior changes, we make sure that we educate you on what you're going to be doing. So not only what to eat and how to prepare your environment, but also the why. We want to empower patients through education because we think it's important that you understand, why should I choose this food over this food? Why should I make this change over that change? So the science is something that we take a lot of pride in and make sure that you are understanding the approach that we have taken based on science. And it is a highly individualized treatment because, as I mentioned, yes, it's based in carbohydrate restriction, but everyone will find their own tolerance that will allow them to achieve reversal, to achieve better sleep, to improve their fatty liver, and get all of those other benefits I mentioned. And we're not pushing shakes or pushing bars or any supplements. This is based on real whole foods that you enjoy. So we don't tell you, oh, eat avocados if you don't like avocados. It's based on your dietary preferences, your needs. If you are lactose intolerant, we can accommodate all of that because it's based on real whole foods. And you learn to eat until you're satisfied. So no walking around hungry all day long. And we'll be making sure that we communicate this with you and how to even know how to do that. Because for many people, this is a new concept. Many people think that achieving optimal health means you have to really restrict your calories. And the truth is, when you're eating the foods that allow you to maintain that blood sugar control, you can much more quickly gain control of that hunger and the cravings, and it's a lot easier to then make those food choices long term. And lastly here, while exercise is great for a lot of things, for mood, might help improve your sleep a little bit, it's not required to reverse your diabetes and really gain control of your health. We focus on the nutrition first. Now, if someone wants to exercise, we are not going to deter you from that. But in the beginning, if someone is not exercising, we really encourage you to focus on the nutrition first. Now, what does it look like to eat your way to better sleep and reverse your diabetes? I just like to show these images because people think that eating a low carbohydrate lifestyle way of eating is all, meat and cheese. Well, guess what? If you are a vegetarian, this works for you. If you're someone who really just likes a cup of coffee in the morning and doesn't love their morning breakfast, that's okay because you get greater flexibility and don't have to eat by the clock and every few hours to maintain your blood sugars. You're doing that through your food choices. And so if you're someone who likes a quick breakfast in the morning, some Greek yogurt with berries and nuts, that's great, that works for you. If you like a heartier, hot breakfast in the morning, scrambled eggs with or without the bacon and sausage, that works for you. These images show that you won't feel deprived because they are really satisfying foods based on how you like to eat. Lunch options, plenty of them. We have a lot of great recipes in the app in our resource center, and so you can take advantage of those. You can create your own. You can dine out all the time if that's what you typically do. Yes, dining out is absolutely easy to do on Virta, and so it really is based on your preference. I love to show these images because when we think of desserts, we think of sugar. And the truth is that when you learn to modify recipes, like these pancakes here, you use an alternative flour instead of traditional white flour. For ice cream, you learn to use a sugar substitute, like a sugar alcohol. And then you can, it's based on heavy cream. And so that's absolutely Virta friendly. So what I'm showing you here is that desserts are not off the table, especially once you feel you've got good control over your blood sugar, your hunger, and your cravings. Desserts can come into play. So if you have that sweet tooth and you think, I cannot do this, trust me, you can. I personally follow a low carbohydrate approach, as does Dr. Van Dort. I love a piece of dark chocolate in the evenings. That's my quick kind of go-to dessert. It kind of rounds out my meal, and that works for me, and we'll find what works for you. But again, dessert's not off the table. But it is all about finding what works for you because everybody has a different amount of carbohydrates that works for them and helps them achieve that blood sugar control. But if we take it back to Wilma here, as Wilma starts to implement the treatment, we're talking with her through text message, almost as you would a friend. So if Wilma has a question, whether it be she's dining out at a restaurant or she has a slight headache and wants to talk about it, the health coach is there to do just that. Again, I said that health coach is going to be pretty much in your pocket, and we really are. Now, a key part of the treatment, remember, is that as Wilma implements these nutrition changes, and the foods I just showed you, as she's doing that, she's going to be testing her blood sugar, testing her ketones. Her weight is going to actually automatically go into the app because we've given her the scale that just automatically sends that number. Those numbers, in addition to blood pressure for those of you with high blood pressure, those numbers come to us, your care team, on a real-time basis. We can see your numbers right now. We can see what they were yesterday. We can see what they were since the very first day of the treatment. Now, Wilma's been with us since July of 2016, so we know what Wilma's numbers were way back. We can watch the trends. We can watch her glucose improvements and her weight loss from the very first day. Now, I mentioned we get this in real time. So if Wilma enters a blood sugar that is significantly improved from what it's been the prior few days, while that's great, Wilma's on insulin. Now, insulin can have a very quick impact on your blood sugar when you are injecting it. So we want to make sure that if Wilma has a good improvement in her blood sugar, we're going to take her off of some of that insulin so that her blood sugar doesn't go too low. And our system allows our providers to make those really quick medication changes because we prioritize our patient needs and can quickly answer those, respond to those needs to our patients. So our physician here is going to reach out to Wilma with that very quick medication change. We also are going to do regular lab follow-ups. So we will be checking your hemoglobin A1C, that 3-month blood sugar control. We'll be testing, your triglycerides and other factors. And not only will we communicate those back to you, we also communicate those changes and all of your improvements to your existing providers. We understand that you out there have probably long-standing relationships with some of your providers, especially your primary care provider. We will take over your day-to-day diabetes management or pre-diabetes management, but it's your existing providers that you'll continue to go to for other reasons. And we want to make sure you feel like you're at the center of care. And so we will do everything we can to make sure we connect with and update your providers over time. And now a lot happens from the point of Wilma first finding out about the Virta treatment to the point where she reverses her diabetes. But I can tell you for Wilma, that happened in about 5 months. She got her A1C down. She got off of all of her insulin. You can watch her story on our website. And that day that she got to stop taking insulin was a really big day. But it goes beyond reversal. So there's more work to be done once a patient reverses their type 2 diabetes. And I will say, the sleep improvements that we reported to you, we looked at that at 1 year. At the point where Wilma reversed her diabetes, I can tell you many patients tell me that they experience better sleep, likely to those improvements in blood sugar and the improvements in insulin. But we're only looking at it at 1 year. So Wilma reversed her diabetes before she improved, we measured her improvement in sleep. And I can tell you that sometimes when patients reverse their diabetes, there's still things they want to work on, whether it be even better sleep, right? They want to get those results that we saw that our patients get at a year. They want to work on their stress levels. They want to find more nutrition options that will just give them more variety. So what we do here at Virta is really focus on getting you to a place where you can maintain that reversal. It's not just about getting that reversal and then saying, okay, you're done. So a big part of how we do that is our online patient community that provides ongoing support to patients like Wilma. So you have the option of joining a patient community through the app. It's private only to Virta patients where you can talk with one another. You can celebrate victories and talk about challenges. So your health coach will be there for you. Actually, a team of health coaches will continue to be there for you, and the community will continue to be there for you. So you continue to have the medication guidance, the nutrition support, and just the overall support to get you to where you need to be long-term. And one of the things that I think I glanced or I glazed over a little bit was with Wilma's success and with many of our patients that one of the other benefits they see that helps really with this long-term sustainability is the weight loss they see. So weight loss is not our primary focus here at Virta, but when you gain control of your blood sugar, that means your blood sugar is lower, your insulin levels are lower. Remember, insulin is our fat storage hormone. So we focus on the nutrition that helps to get your blood sugar under control. And in doing so, patients are losing at 1 year an average of 30 pounds. And if you remember, some of the things that help improve your sleep are weight loss, it's good nutrition, right? So these things all play into one another. And some key takeaways that I'll leave you here today with before we get to the questions here is great. So keep your questions coming, please. Poor sleep is a problem. Many people experience it, and especially those with type 2 diabetes. Greater than 50% of those individuals experience poor sleep. Better sleep is associated with better insulin sensitivity and glucose sensitivity. And we can help improve that with Virta because remember, we get control of your blood sugar, which helps to reduce those insulin levels. And for those who qualify, the Virta treatment is covered. And I promise that we will send information after this webinar for you to apply. Now with that, I will bring back Dr. Van Dort, as well as Morgan is going to join us if any questions arise that Morgan will be answering. So thank you, Morgan, for joining. Okay, so how does high blood sugar affect sleep? Dr. Van Dort, is that something that we know the exact physiology, or is it because of inflammation and all these other factors that could contribute?
I don't know the direct link there, but I would say like chronic high blood sugar, you get inflammation, and then the inflammation could influence the sleep for sure.
If your immediate family had diabetes, are you more likely to have diabetes as well? There is a genetic component that we know can play into your likelihood to develop diabetes. That does not mean it's a sentence. And there's a very big difference there. So it doesn't mean that because, Dr. Van Dort and I both have family members with type 2 diabetes, we see that. And so we're taking every approach we can to control our environmental factors and our food choices to make sure that that genetic component, we can't do anything about the genetics, but we can do things about the things we can control, right? Like the food that we eat, our stress levels, all of that we can try to control. So that's a little bit about the influence of genetics. Okay, great question. Somebody asked about, is there a recording available? So yes, within a timely manner, this will be available to you all, I believe, as well as to the people that signed up and were not able to attend. So you will have the chance to watch this again. Is it possible someone could be pre-diabetic without knowing? If there is a possibility glucose is slightly elevated, but the primary doctor does not test hemoglobin A1C, absolutely. So your hemoglobin A1C is looking at the average of all your blood sugars over a 3-month period of time. So that's how they'll know, they'll diagnose it typically, but also a high fasting glucose can be indicative of pre-diabetes or type 2 diabetes. And we actually do that in our screening. Many people come to us not knowing that they actually are pre-diabetic or have type 2 diabetes. And so that fasting blood sugar or the hemoglobin A1C can be indicators of the diagnosis. But if you don't know, if you have one of those, I would still encourage you to apply. There's no obligation to go through the application process, as well as it does not cost you anything. And so I would recommend that if you are curious and you are curious about the treatment, that you still go ahead and start that application process once the link comes through in that email. All right, I'm going to give people more time if they have questions, because we want to make sure that we answer everything pertaining to sleep, pertaining to the Virta treatment, pertaining to type 2 diabetes. We do have a question here that I missed, so I apologize for skipping it. Does the time of day that sugar is consumed affect sleep?
So yeah, you do tend to be more insulin and glucose sensitive in the morning versus in the evening. So it's generally recommended that you stop eating a few hours before you go to bed at night to improve your sleep. So if you are going to have sugar, your body's better able to handle it first thing in the morning.
Thank you. Here we go. Another one for you, Dr. Van Dort. Does sleep apnea and diabetes go hand in hand?
So a lot of times the association there is probably due to like the increased weight, because it's an obstruction. So like if you lose weight, or especially in your neck area, then you're less likely to have the obstruction. So it could be related to the diabetes leading to obesity, and then the obesity leading to obstruction. But the exact relationship there is not known.
And actually, as patients with us lose weight, we actually recommend at a certain amount of weight loss, that if they do have sleep apnea and they have a CPAP machine, that they have their CPAP adjusted to improve their quality of sleep as they continue to lose weight. So, and many people we also find have not actually been diagnosed with it. So we always encourage patients, because of the high prevalence rate, we always encourage patients to be tested for that and see their doctor. I am both a type 1 and a type 2 diabetic. Will Virta work for me? So the interesting thing is, I know there's different classifications of type 1.5, and we'd really have to work with our Virta providers to see if you specifically would qualify based on your medical diagnosis. We specifically do not enroll patients who were born with or develop type 1, the actual autoimmune disorder, but sometimes those with type 2, again, get classified in those in between with like type 1.5. So please don't let that discourage you. Let's talk about it. But I will say, even regardless of our eligibility criteria, patients who follow, not Virta patients, but people who follow a low carbohydrate nutrition approach who have type 1 diabetes have great success. It's always recommended to do so under medical care. Of course, you want your provider on board, your doctor should know, but I've seen great success stories for all patients, because at the end of the day, all of this comes down to some sort of issue with blood sugar. And restricting your carbohydrates has a really, really strong impact on improving your blood sugar. Do you know if family members qualify for the Virta program? So some employers are covering the treatment for employees, spouses, and dependents. So you have to be at least 18 years of age, but some employers are qualifying. So you will find that information out after this webinar when we give you your employer-specific link. Still going to give more time because we still have about 7 minutes here. So I want to make sure that people who have questions can have those answered while you have us on the line. And I'll throw out any questions that you have about actually implementing the nutrition, how you interact with your health coach, a little more on sleep, since again, we have the experts here today. Even if it's something we didn't talk about, we're here to answer your questions. Okay, from my teens to early 30s, I suffered from hypoglycemia, so that's low blood sugar. Is that a precursor to being a type 2 diabetic? Type 2 runs in my family. That's a great question. So any sort of issue with blood sugar control could be a warning sign of potentially down the road developing type 2 diabetes. Another one is often oh my gosh, pregnancy and diabetes, gestational diabetes. Sorry, I couldn't think of the word. Gestational diabetes, hypoglycemia, any of those sort of things could be just indicators of, hey, be careful. Also, the predisposition with your family, those are all signs. So it's something to keep an eye on for sure. I am taking, so listing several blood pressure and blood sugar medications. Will I still need to be taking these while on the treatment? Also, will you be prescribing any kinds of meds other than what my primary doctor prescribes? So typically, we do not prescribe medications. We de-prescribe medications. And in order to de-prescribe, we only do it based on a safe way of doing it. So as I mentioned, we aren't on day one just going to eliminate all your blood sugar medications. We will do so in a stepwise manner as we see your blood sugar improvements, but your doctor and your health coach will be communicating that. And actually, mostly your health coach will communicate what your doctor is telling your health coach. So we'll let you know what medications to make the changes and when, as well as, in terms of, you asked about adding medications outside of what your primary would prescribe. There have been times where we might swap out a medication if we're trying to get you off ultimately. But again, we'll make sure you're clear on those instructions. And our overall goal is to de-prescribe as many medications as possible. Do you give a sample menu of items to eat every day? We absolutely do. We have in our resource center, we have several, 2-week menus actually. We have tons of recipe options. We have just, if you are a snack person and you love to kind of graze throughout the day, we give a lot of snack ideas. So we'll give you all kinds of advice and resources and guides to help you make the right food choices. Does drinking lots of water help with blood sugar? Well, you should be hydrated, and absolutely being dehydrated can show a higher blood sugar reading. So you should absolutely make sure that you are always drinking adequate amounts of fluid. These are great, keep them coming. So does your body type dictate if you are prone to diabetes? So people that carry potentially, weight in their abdomen, that abdominal adiposity, the type of body that you have. So it's not a direct indication, but again, there's that genetic component, there's the environmental factors. If you do carry weight, in your abdominal region, you will probably respond really well to our treatment. On average, how long do you have to be on the program until you start seeing results? Okay. This is so individual. We see blood sugar improvements on day 1 for many people. So much so that we actually do have to cut medications before even making any sort of dietary changes. We see very early results in many patients as early as 70 days. Many patients are able to reverse their diabetes, and we actually have peer-reviewed research out on this very thing. So at 70 days, over half of our patients are able to reverse their type 2 diabetes. The results happen fast, and then they sustain the results because, as I mentioned, the 1-year results, 60% diabetes reversal, and then actually our 2-year paper has just been, is out soon, so look for that. So people are sustaining these results, but they're getting a lot of results quickly. But it does happen at a different point for everyone. All right, I'll give another minute because we have that much time left, but I want to give you another second for questions, and thank you all for joining and sticking around. Many of you stuck around. I see a hand raised in here, so if that means you have a question, please go ahead and put it in here before we sign off. Just going through to make sure I got all of the questions. If I missed yours, please enter it again. Is there a fee to enroll? No, there is no fee to enroll. And again, if your employer covers this, then you will be completely covered for the $5,000 benefit, and you will not have to pay. All of your visits with us, all of the times you interact with us, every time you go onto the app, all of that is going to be included, and your employer will pay for it if you qualify. The only out-of-pocket cost may be a copay on the EKG that you can have done at your primary care provider. But again, we'll help walk you through all of that. You'll have a single person to talk to, which will be your enrollment advisor, who can help walk you through all of that. So I would encourage you all to do so. All right, well, thank you so much, all of you. Thank you to my collaborators on the line today. And mostly, I hope to see you all on the other side after applying for Virta and hopefully on your way to diabetes reversal and better sleep. Thank you all for joining.
Thank you.
Bye.